Narcan saving lives in opioid overdose emergencies. Introduction. Importance of Narcan. Narcan quickly reverses an overdose by blocking the effects of an opioid or opioids. It can restore normal breathing within 2 to 3 minutes in a person's whose breathing has slowed or even stopped. More than one dose may be required for stronger opioids like fentanyl. When stronger opioids like fentanyl are involved. Understanding overdose. The number of people who have died from a drug overdose in 2021 was 6 times greater than the number in 1999. From 2020 to 2021, overdose deaths increased by 16%. Over 75% of the nearly 107,000 drug overdose deaths in 2021 involved an opioid. Opioid deaths had 3 distinct waves. The first wave began with increasing prescriptions of opioids to the general public, semi and natural opioids. Second wave began in 2010 with rapid increase in overall in overdose deaths involving heroin. The third wave began in 2013 with significant increases involving overdose deaths involving synthetic opioids, particularly those involved with fentanyl. Signs and symptoms of opioid overdose: loss of consciousness, limp body, slowed breathing, choking, vomiting or gurgling noises, small pinpoint pupils, pale, blue, and cold skin, heart rate is slow or has stopped. When to administer Narcan. When encountered with a patient exhibiting respiratory distress with a confirmed or suspected opioid overdose, EMR and EMTs can administer Narcan providing the following criteria have been met. Indications: a patient suffering respiratory depression caused by a known or suspected opioid/narcotic overdose. Contraindications: no clinical findings significant in the adult patient, no signs or symptoms present. Patient is less than 28 days old. Administering she took the Narcan. Administration via meter dose pre-filled Narcan syringes. Gently insert the tip of the nose into one nostril until your fingers on either side of the nostril are against the bottom of the person's nose. Press the plunger firmly to give the dose of Narcan. Remove the Narcan spray from the nostril after giving the dose. Apply supplemental oxygen. If the patient is not breathing adequately, use a BVM, 10 to 12 breaths per minute at 15 liters per minute. If the patient is not breathing and has no pulse, follow CPR protocol. Post-administration care. Monitor the patient for response to Narcan. Ensure EMS is en route. If the patient becomes alert, provide support and reassurance. Monitor vitals. Those are the sources and references. Cool. Done.